Urticaria, hives. Urticaria, also known as hives, wheals, welts or nettle rash, is a raised, itchy rash that appears on the skin. It may appear on one part of the body or be spread across large areas. The rash is usually very itchy and ranges in size from a few millimeters to the size of a hand. Types of urticaria. Acute urticaria, if the rash clears completely within 6 weeks. Chronic urticaria, in rarer cases, where the rash persists or comes and goes for more than 6 weeks, often over many years. A much rarer type of urticaria, known as urticaria vasculitis, can cause blood vessels inside the skin to become inflamed. Who's affected by urticaria? Acute urticaria, also known as short-term urticaria, is a common condition, estimated to affect around 1 in 5 people at some point in their lives. Children are often affected by the condition, as well as women aged 30 to 60, and people with a history of allergies. What causes urticaria? Urticaria occurs when a trigger causes high levels of histamine and other chemical messengers to be released in the skin. These substances cause the blood vessels in the affected area of skin to open up, often resulting in redness or pinkness, and become leaky. This extra fluid in the tissues causes swelling and itchiness. Histamine is released for many reasons, including an allergic reaction, like a food allergy or a reaction to an insect bite or sting. Cold or heat exposure. Infection, such as a cold. Certain medications, like non-steroidal anti-inflammatory drugs, NSAIDs, or antibiotics. Diagnosing urticaria. Your GP will usually be able to diagnose urticaria by examining the rash. If your GP thinks that it's caused by an allergic reaction, you may be referred to an allergy clinic for an allergy test. However, if you've had urticaria most days for more than 6 weeks, it's unlikely to be the result of an allergy. Treating urticaria. In many cases, treatment isn't needed for urticaria, because the rash often gets better within a few days. If the itchiness is causing you discomfort, antihistamines can help. Antihistamines are available over the counter at pharmacies. Speak to your pharmacist for advice. A short course of steroid tablets, oral corticosteroids, may occasionally be needed for more severe cases of urticaria. If you have persistent urticaria, you may be referred to a skin specialist, dermatologist. Treatment usually involves medication to relieve the symptoms, while identifying and avoiding potential triggers. Complications of urticaria. Around a quarter of people with acute urticaria and half of people with chronic urticaria also develop angioedema, which is a deeper swelling of tissues. Angioedema. Angioedema is swelling in the deeper layers of a person's skin. The symptoms of angioedema can affect any part of the body, but usually affect the eyes, lips, genital, tongue. Medications such as antihistamines and short courses of oral corticosteroids, tablets, can be used to relieve the swelling. Emotional impact. Living with itchy skin can be particularly upsetting. It also found that 1 in 7 people with chronic urticaria had some sort of psychological or emotional problem. Anaphylaxis. Urticaria can be one of the first symptoms of a severe allergic reaction known as anaphylaxis. Anaphylaxis should always be treated as a medical emergency. Thanks for watching. Kindly subscribe my channel Blissful Skin for more videos and updates.